Activated charcoal is not indicated in the treatment of poisoning with. Yes, 10 more seconds to go. Right, I think the majority have got the correct answer, but it's around, I guess, 50%. So I think, as Dr. Ravi mentioned, activated charcoal is a very good adsorbent, which will absorb a lot of toxins, but unfortunately with certain material and substances like methanol, alcohols, hydrocarbons, it won't work. So it's not indicated in that instance. Right, second question. A 50-year-old man with CKD stage 5 has ankle edema, creatinine 2.5. Potassium is normal. What advice is not recommended? Which advice is not recommended? Right. Avoid fresh fruits. So I think Professor Shamila wouldn't be happy. I mean, if the majority didn't choose this, so majority have chose the correct option. Of course, if the potassium highs, we do advise to reduce high potassium containing fruits, but not all fruits, obviously. When change clinical information in shift handover, what is most important? Right, so correct answers, I know most of the answers are correct. I think I won't be the expert in explaining this. For the most important item, I guess, is using the agreed format to exchange information. And one interesting thing I came across is even the NASA, the institute, have borrowed to exchange information with their astronauts and their centers on Earth using the shift handover and reliable that system is. And of course, the two nurses in here is not from my hospital or my ward again, it's all AI generated. What would be the maximum total mu score of a critically ill patient can have? The total highest mu score a critically ill patient can have. Right, the correct answer is 18. If you calculate, there are 6 criteria, and maximum score would be 20, 3 to 6 plus oxygen. Sorry, the answer should be 20 here. There's a mistake in preparing. So you have added, you have to add 2 to 18 because with oxygen you add 2 to 18. So 3 into 6, 18 plus 2 will be 20 altogether. So it's the correct answer would be 20. The fifth question, recommended insulin regime in the acute management of DK is? Easy question, I guess. Right, I think yes, about 75-80% have got the correct. It should be an insulin infusion, not mixed insulin with others should be continued because it's a diabetic emergency. What should be used to clean a blood spill in the hospital? I think Madam Bhagya emphasized on this fact in her lecture. writes not chlorhexidine, 1% freshly prepared hypochlorite. I think the important points are here that it should be freshly prepared, and I think 10% is very high concentration, which we don't use. And one again interesting point that I across was, if you use clean urine, it'll cause a chlorinated gas. Am I correct, madam? So it'll be hazardous. So never use to clean spilled urine, but just blood. Right. So again, it's a very important area again. So make sure that you adhere to the appropriate guideline. Question number 7. Which of the following statement is true regarding antivenom? Yes. So it should be dissolved in distilled water, sterile water. When you see, I think you, along with the anti-venom vials, you will sometimes get a distilled water vial. So 10 or sterile water vials, 10 ml should be dissolved in the powder, dissolved in 10. Constitute it with any of the fluids. Even 5% dextrose can be used, although we commonly use saline to dissolve it at the end, because it's the commonest, most commonly available fluid. But it doesn't need to be necessarily always dissolved in or mixed with normal saline. Even 5% dextrose can be used. So what is most important is it should be mixed. The initial powder should be mixed with sterile water or distilled water. What is compassion? Most of the answers might apparently look correct, but what is the best answer? We are asking for the best explanation. Yes, that's right. So it's understanding and willingness to help suffering, the suffering of the patient would be the best answer there. Question number 9. What would be the best thing you can do when you first meet up with a patient? Of course, the picture would give a clue as well, I guess, here. Right, of course, yes. I think most of our nursing officers wouldn't need, this inherently. When you care patients, this would come. But just to make a note of it. Question number 10. A 40-year-old presents with vomiting for 2 days with a blood pressure of 90/70, hypotensive. What will you take from the emergency trolley to treat this patient? Is Lakmali madam's question. I have made it short because we could not incorporate all the words. The number of characters are limited. Yes, of course. I think can see madam is happy. Of course, you'd be very unhappy if he chose 174 has chose noradrenaline though. But of course, we find many anesthetists being very unhappy when you send patients on noradrenaline without resuscitating the patient appropriately with fluids. So mind you, when the patient is hypovolemic or dehydrated, first we have to treat with crystalloids, hydrate first, and then start on vasopressors rather than just rushing to start them on vasopressors. So 11th question, what is the incorrect answer regarding the antibiotic chart? So this has got a bit a longer stem, so we have given 45 seconds to answer. Again, a very important topic, recently introduced concept into our hospital setup. Right, antibiotics cannot be documented with along with other medications. We used to do that in different color, but now there is a separate chart, so it's not followed anymore. Yes, even LPT is possible. I think, yeah, the last question. A patient with pneumonia is receiving oxygen via face mask. Increased work of breathing is indicated by which of the following? Again, very important and a practical question. Right, yes, obviously it's use of accessory muscles. Whenever you see a patient in respiratory distress, it should be escalated accordingly.